Today's session explores a very important question. How do we shift resources, trust, and power into our communities so that they can shape how health inequalities are reduced? We know that communities hold knowledge, relationships, and lived experience that councils and public services can't always replicate, but often that insight remains untapped, maybe because of system barriers or sometimes because communities don't trust that their voices might influence decisions. As cooperative councils, we're committed to doing things differently. The CCIN principles you see at the top of the screen there of innovation, co-production, social partnership, and democratic engagement underpin the initiatives that you'll hear about today. These values push councils towards equal partnership with residents and with the voluntary and community sector. And that's really what today's conversation is about. It's about moving beyond consultation and beyond tokenistic, forms of involvement towards community power that is real, practical, and embedded in policy and delivery. So in this session, we'll explore those cooperative values. Um, in sorry, we'll explore the value of those cooperative principles in reducing health inequalities, and we'll hear reflections on the operational realities from our speakers. And on that note, we're joined by three brilliant sets of speakers who each bring a different model of community-led initiatives. So we've got Leanne Cooper and Gertrude Packott from Oxford City Council, Rich Browning and Holly Walsh from the Healthy Me, Healthy Community CIC, and Kate Steen from Liverpool City Council, and Rebecca Ross-Williams from Liverpool Lighthouse. As you listen today, I'd encourage you to think about your own local context. And what would it take to move from community engagement to genuine community leadership? And yeah, so that's enough from me. And I'm going to pass over to our first speakers, which will be Leanne and Gertrude from Oxford City Council.
Hi, I'm Leanne. So I'm the locality manager for a section of Oxford, but I'm here to represent Oxford City. And my colleague Gertrude Packott, she's our Community Health Development Officer for two of the most deprived areas in Oxford, one of them being Barton, which is why she's joined me, and she will go into how her role has supported to bridge the gap between a sort of long-standing area of the city with a new healthy new town that's been built alongside it, and how we bridge that gap to support the residents of both sides, especially when it comes to health inequalities. Next slide. So this slide is just a little snapshot of some of the statistics that we're working on. So every year we have a look at the statistics that come through and just have a look to see if anything's changed or anything that's different that we need to work on. So this is just a snapshot. So the main things that we're looking at is the life expectancy, especially in males. So between North Oxford and Barton, it's 9.6 years less, which is astonishing, really, considering it's like a 10-minute drive. So that's the sort of thing that we'd be looking at and how we can support with that. Again, the same with women, but it's 4.9 years less. We've got 36% of children in Barton, which are carrying excess weight or obese. We've got 35.2% of older people living in Barton that are living alone. So we've got quite a big portion of people that are isolated. And then we've got 30.4% of children in Barton living in poverty, compared to the Headington ward, which again, the other side, but is literally a 5 to 10 minute drive away. So the area is surrounded by, so the area itself is high deprivation, but the surrounding areas aren't. So there's a lot of diversity in the area. From Barton to the city centre is 3.4 miles, so we're quite close to the city, and we're on a main bus route. So I think the travel side of it is actually really good from Barton to the city. Next slide. So this is just a snapshot of what's available. So between Barton and Barton Park, there's lots of assets, there's lots of activities, there's lots going on that can connect the two areas. We've got the neighbourhood centre in the older side of Barton, which connects everybody together, and then we've got a pavilion in the new Healthy New Town, which also connects people from Barton and surrounding areas over. The development was built with public art, so we've got an art wall in Barton, and then we've got the art displays in Barton Park. So everything we've done in Barton Park, we've tried to link to Barton. We've got a music centre, we've got GP surgeries, we've got a leisure centre. So within that small space, there's lots and lots of assets and activities for people to access and bring the two areas together, which is our main aim. Next slide. This is just kind of a little bit of background information on Barton and sort of where the development began. So 94 acres allocated site. We've got a convenient road and railway network connection. It's adjacent to Barton. I mean, there's literally a road in between the two areas, and again, Barton is in our top 20% most deprived areas. And yeah, so that's kind of how it looked before anything was touched and before the Healthy New Town was developed. So we've done this in partnership with Grosvenor. So they were our main developers at the time when it started. Next slide. And then this is kind of the vision, which we're very nearly there. So the vision was 885 new homes, and 354 of those are social rented. We're now onto the final phase, so we're just at the final phase of the build, and then the shops will be the last part of the build, so there'll be 3 or 4 shops there as well. And then yeah, there's just some sort of key facts of what we was doing as it develops. So we've got the linear path, we've got the play areas, we've got the pavilion, there's a primary school, the integrated community hub. We're on one of the main A40 roads, so it's very accessible, and we've had a huge improvement on the allotments that border between the two areas, which is also really good because it means we're bringing the two areas together. Next slide. And this is where I'm over to Gertie, because this is where it pulls her job into the connection. So I'll pass over to Gertie.
Thanks, Leanne. Thanks for the quick introduction. So my name's Gertie. I'm the Community Health Development Officer for Wood Farm and Barton. So I share my time across the two areas, and I think my role is quite a new role across Oxfordshire, but I think across the country, and it started with this redevelopment. So my post was created as the redevelopment with Grosvenor began, and in redeveloping that area of Barton, and the main target for my role was to really bridge existing Barton to the future new Barton and help communities integrate and really connect and be able to use the new assets that are being built in Barton Park, but also encouraging the new residents to make use of the existing community centre, leisure centre and community spaces that are available in the existing Old Barton. So my role was really important in some of the my role at the beginning was really important in some of the planning stages, so making the new spaces really friendly and welcoming for old residents, but also the new residents that are joining. So this in the very beginning, as the development was really at the foundation blocks, there was lots around healthy place shaping, so looking at where we can build planters and pathways and cycle tracks and things to make sure that people have that clear access and feel welcomed across the board, and it's not such a clear divide. I think obviously with the new estate you've got lovely new roads and new buildings, is quite distinct where the investment is and where it's lacking maybe in the older estate. So it was really important to make sure that people feel like it is still their community to use. So I worked lots around, I wasn't quite in post at the beginning. My predecessor worked really closely with getting notice boards and art displays and street art projects set up for all residents, particularly targeting the new primary school that was in the early stages of being built and now is built with lots of children every year, and the existing primary schools, just to bring those families together in joint projects across Barton, not just in the immediate vicinity of the primary school that they attend. Some of these were incredibly successful. I think, if we move on to the next slide. Yeah, so just to recap, I guess my role as the community development officer, I focus lots around bridging that gap of council and community. So I am the face of the council that's at sort of the local community events, the community fairs. I work really closely with youth clubs and youth centres in making sure people's voices are heard and they've got a face to ask questions from, or raise issues with, or build new projects. So I work particularly around new projects, so new ideas that can be brought to life. I think good examples across the board have been residents coming forward saying, oh, they'd love to have a women's fitness class, which doesn't exist, where you can take your toddlers. And I've supported people to step up and build their own community interest companies or build their own charities to make a service possible for them, for their community. So it's really closely working with how we as a council can work with our communities to build them up, as opposed to implementing and parachuting new ideas on them, which might not be sustained long term. I think that slide summarizes a lot of what I've been explaining, so thank you. Some of the projects that have been set up are still being set up and are due to be set up are just on the board on the slide here. So I've worked, I have really close partnerships with Leanne, the locality manager, but also our local health centres, so social prescribers and wellbeing workers at the health centres, looking at some of their priorities, any arising priorities that might change along the way. So working to meet the needs of their patients, who are again local, and supporting them and bringing more things to life. So that might be things like health walks and men's mental health football sessions, wellbeing gardens, this sort of thing. So I'll work very closely with helping them set up a new session, and then supporting residents or local volunteers to sustain that. A big part of my role is grant funding. So at the early stages of my role, there was a public consultation that was completed in Barton. This came with a very long comprehensive review of what local people feel need to change in Barton for them to live healthier and better lives. This long report ended with 6 key recommendations. My role solely focuses on meeting these recommendations to the best of my ability. So the recommendations in Barton, for example, are around models of care and built environment and targeted youth and healthy eating. So they can be quite broad in how I look to meet them. But I work with local people to see how best these can be met in a way that people will use the facilities or services that we then start and take value from them, but also sustain them, because I think the main goal of my role is to support residents and local people to implement new projects that they then take ownership. So I could take a step back and focus my time on other projects and new projects, and often arising priorities, because although this report was really comprehensive and really detailed, things change and new priorities come up, and new targets are set, and I constantly get requests from residents and organisations in Barton saying, oh well, this is really great that this is happening, but it would be fantastic if we could get more, or do something a little bit different. So then it's important that I've got time and support to be able to meet these new priorities. So at the end of with the recommendations, initially we were granted £25,000, which could be focused on a local grassroots organisation. So looking at whatever the local youth club and the projects they serve. So they could submit an application and start a new session that they might not have been able to start before, but with this grant funding it gave the option for new ideas to come to life, which is really exciting. If we carry on to the next slide. Yeah, so further details around the grant funding. So this really helped new ideas to come to life in Barton. I think we're currently at the phase 2 of the grant funding. So in the application process, everyone had to submit, every project interested in applying had to submit an application. This was then reviewed by a community panel. So it was my role to bring local people, organisations, volunteers, local legends, as we like to call them in Oxford, to step forwards and review these applications and come to a decision in how this money is best spent in Barton. From this, we've had 22 applications for phase 2, which is really exciting, and we've decided to fund 12 projects, which should be starting come April, May of this year, which is really exciting. And we've got a final phase, which will begin likely later on in likely June, July of this year for applications, with grant funding available until March next year. If we carry on to the next page. Yep. So just to give you an overview of the recommendations in Barton, these are the 5 targets I'm focusing most of my time on at the moment. Again, looking at rising priorities as and when they come. If we carry on. So in Barton, there was a huge focus. Well, 3 key themes came from the recommendations. One of them being long-term funding, so looking at how we can support funding. So for the second and third phase of funding, we supported previously funded projects with an expression of interest as a part of the application, so ensuring that they feel supported with this grant funding to sustain the projects that might have been piloted initially to continue longer term. There's definitely been a focus in my time and our local schools and communities in more outdoor activities, especially around sort of gardening clubs, larders and church groups. So I'm doing a particular project at the moment with the primary schools to support their outdoor spaces with planters and allotment spaces to help children understand the value of growing your own food, the processes, and helping them become more familiar. So that's a project at the moment in the works for this spring. And we also support a lot of groups with joint funding. So the idea is bringing different groups together, different volunteers, different churches, organisations, larders, whatever it might be, to apply for applications or apply for projects in partnership, because then we can bring more money, more facilities, more services into the estate and help replication of any projects that might be happening. So I work really closely with connecting people and groups in similar projects or similar areas of interest. If we carry on. Okay, thank you. That's excellent. So this is just a little bit more detail around the grant funding applications and how many we've had successful. If we carry on. As a further part of my role is the Community Health Partnership. This is a meeting that I run every quarterly, and it brings together key health partners across Barton. So anyone with an investment in health or wanting to raise the rising matters or comments or projects, we all come together quarterly to discuss the recommendations, the progress we've made on each recommendations, new priorities that might come up, and further needs that are important to address. So this is really well attended. We often have a half an hour at the end for networking, for people to really connect and share ideas and bring that partnership work together in Barton. But we focus around any health matters. So a lot of the social prescribers attend, intermittently GPs, health partners, sports leaders, school representatives. So it's a really good community meeting for everyone to come together and raise issues or raise positives that have happened in Barton. as a part of this as well, I deliver a health promotion event once a year, which again brings together partners, but that's a resident-facing event where residents from Barton, but across Oxford, can attend to meet local services that are available to them. So yeah, this tends to be quite well attended with, I think, upwards of 20 partners that normally attend, and various residents. So yeah, I think that summarises the partnerships if we carry on. Yeah, so just to summarise, I suppose, a couple of pictures of some of the great work that we have delivered and we look to deliver going forward. So you've got some of our youth activities on the picture. We run an annual Barton Bash now, a Barton Bonanza per year, which is really fantastic. It brings residents together. It allows them to see what services are available, but also creating a fun community event that people enjoy attending. As well as like yeah, half term and school activities with the youth partners that we have here in Barton. So thank you so much for your time. I think that brings us to questions, if anyone has any.
Hi, yes, thank you. That was really interesting, what you've done. And you said it was quite new. You were quite new to this when it started. How long ago did you start this project?
Okay, so I think that this initially started in Barton, I think 5 years ago. In Wood Farm, this was only a year ago. So in Oxfordshire, we've got 10 priority areas, and in the last year, it's been 14 priority areas with the with the areas of the highest deprivation in Oxfordshire. And these areas have health development officers like myself. Some of us have 2 areas, some of us have 1. It depends on the size of the area we're covering.
Brilliant. It looks really good. And how easy was it to get the community to engage with yourselves?
So initially it was really quite difficult. I think there is definitely that. I think local people, especially in Barton, had this view of the council as, you know, this horrible organisation that take your council tax, and you know, it really wasn't a pleasant a bridge to gap. And I think initially I just spent a lot of time in local groups, so going to local larders, going to food banks, attending events, speaking to people and helping them understand that I'm there to support them. I'm there to take questions and support them to build up this community, as opposed to just come in and parachute something new, implement something and then disappear. So I think that continuity and consistency really helped to build up trust with community organisations, but especially residents. Whereas now I've built up lots of great relationships with residents, but also partners. I can be a point of call for everyone, which is really valuable, and it just means I'm involved in a lot of the organisation of different events. Obviously I attend and I'm able to support them, and the grant funding to support projects has been incredibly helpful, because I wasn't just able to advise and support with further grant applications, I was able to provide some of that grant funding myself. So it's been really it's been a long journey, but I'm pleased to where we are.
Thank you so much for sharing. Really inspirational for what we're doing. So thank you.
I think as well is being able to have some money on the ground has helped build those relationships, but also the residents being involved in those decisions. That wasn't just us thinking, oh yeah, we need a breakfast club, let's just create one. We spoke to the residents and got their engagement, but also then they've seen results of what they fed into, and we've kept feeding those results back. So I think that's really helped build those relationships. Also didn't help that this all happened at COVID times, so we were trying to build relationships with people that weren't coming out of their houses and were really suffering with isolation. So now we see them regularly. It's really nice to see how that's completely turned, which is really good.
Yeah, just echoing as well. Thank you. It was a really interesting presentation. I just wanted to ask about sort of noting that you had a sort of new development coming in. I was just wondering about the funding for your post specifically, and I guess sort of the grant money as well. Like, was some of that funding it come as part of sort of Section 106 and the new development? And then I guess going forward, is the view to keep your post as a full-time post in that area? And will you continue to have grants, or was it sort of time limited to forge some of those relationships and then sort of take a step back? So the sort of sustainability of that.
So the posts were funded by Public Health,
Right. Okay.
So they're funded externally. So we had a previous community health development officer to Gertie, who was worked alongside Grosvenor, so they funded part of her role, and then Public Health funded the other part to bridge the role and the two areas together. So going forward, we've got Gertie sort of 2.5 days a week technically per area to continue that. But yeah, it's funded by Public Health, and then the grant funding, I think the aim was to give it to the community groups to start them off, but that's continually rolled. So at the moment that's happening, but how long for, we don't know. Which is what we're trying to move away from, because giving people funding 6 monthly or yearly is really difficult, and we've fed that back from the grantees as well, that not having a longer term plan is really difficult for them, because just as we fund them, their funding is being used, and then they're looking elsewhere for more funding, and then we might pop up with funding that they have then had to go away and find other funding for. So it's really confusing for the grantees. So hopefully we're moving to a point where we'll have a longer term pot of funding, all being well. And then the same with the roles. So we hold 4 community health development officer roles in the City Council, and they're all funded externally by Public Health. So we're trying to again get a 3-year plan of funding for them, just so they're not also working year on year waiting for their contracts to be extended, etc. So that's the aim, is that we get a longer term plan, but at the moment we don't know.
Great, no, that's really useful, thank you.
Did I cover everything in that, Gertie? Because obviously it's your role.
Yeah, I think you covered it perfectly. Thank you, Leanne.
Thanks, Leanne. Thanks, Gertie. Yeah, there's no other questions in the chat. But yeah, we'll share your slides with everyone, and if you're happy, we'll include your emails in there as well, in case anyone wants to chat about anything further. But yeah, thank you. That was a really interesting and insightful presentation. So next we'll be moving on to apologies, just hit my headphones. We'll be moving on to our next speakers, who are from the Healthy Me, Healthy Communities CIC, based in Manchester. Passing over to Rich and Holly.
Hi, welcome, and thanks for keeping to time, and we'll aim to do the same too. Just a little photo there of our community hub of where we're based. We're based in one of the most deprived wards within Manchester. And what I'm going to do is just give you a little bit of an overview of Healthy Me, Healthy Communities. And that's going to frame the work which we're here to talk about today, which is a partnership with Manchester City Council. We're commissioned by those to deliver the Making Manchester Fairer Community Forum. Yeah, so I'm Rich, I'm the CEO. Alongside being a CEO, I hold a couple of roles which lean into the community voice, the community power aspect. So I'm the Vice Chair of Manchester Food Board, and I'm also a member of the Manchester Biomedical Research Centre, which looks at translational and inclusive research around health. Joining me today, you'll soon meet Holly. And I'll let Holly explain a little bit more about herself, but Holly is our Chief Operating Officer and leads the work and the partnership with Making Manchester Fairer Community Forum. And also there's a picture of Kate and all, who makes up our senior team. So Healthy Me, Healthy Communities, we're all about health and well-being, all about the determinants, the social, the commercial, the neighbourhood determinants of health. And our vision is for everybody enjoying a long, healthy and happy life. So, like I say, just a little bit outline a little bit about our work, and this helps to frame both how we support and also some important aspects for the effectiveness of the community forum, which you'll hear more about soon. So our purpose, we work across 3 strands, and that's about making a big difference to people's lives, creating lasting positive change for communities, and a really important aspect of our work is improving practice and policy. So we're very much about taking what we learn on the front line with residents and community groups, and how we can translate that into and how we can improve and influence future practice and policy. And from a frontline point of view, in terms of our delivery, that means we group our work around how we connect and collaborate, and that's residents coming together, but also how residents and partners can come together. We have stranded work around our skills and wealth building, and then the important aspect, which we'll talk more about today, is our power and practice work. So a little bit of a taste of those. So there you're sort of from our hub and from some of which our partners deliver. There's some of the aspects of some of the work we do around our connect and collaborate work. So your sort of typical things which you've heard of, which Oxford are doing similar things around lifestyle activities, growing activities. And an important aspect is partners coming in, local community groups, resident-led, delivering activities within the space which we provide. Next slide, please. So our skills and wealth building, we've been engaged within food insecurity and food aid for close to 10 years. And we deliver both food aid and a growing project. And really sort of behind that is about looking at what the causes are of financial insecurity. And that's around the signposting and advice to making sure people got access to welfare advice, debt advice and such things. We deliver frontline and accredited community learning, offer volunteering, and a really important aspect is that we offer local jobs. So we provide pathways from people being a participant into volunteering and into jobs. And then the final slide for myself, I think so. So our power and practice work. So Holly's going to very much talk about the first block there, which is the Making Manchester Fairer Community Forum. We've also got, we're sort of halfway through the first year of a new programme, working again with Manchester City Council as our Leaving Care collaborative work. And like I say, it's a partnership with Manchester Council, and it's about supporting care experience to young people, 16 to 25, particularly with a focus on NEETs. And it's about how they can have more control over the decisions which affect their life, how they can influence and improve the future system, both for themselves and for future people, alongside that very much that sort of skills and work-based approach too. And then we deliver a neighbourhood-led grassroots collaborative approach around a community power forum. And we're very much involved in health research of how we can bridge that gap between the clinical research which happens to involving those who would most benefit from the research. And an important aspect of our work of how we sort of take that frontline work and how we then can influence and embed it within future policy and practice is around some of our roles. And there's just a little taste of some of those. So yeah. Nice little taste there, sort of potted thing of healthy me, healthy communities. And I'll now pass over to Holly.
Thanks, Rich. Making Manchester Fairer is Manchester City Council's public health approach to reducing health inequalities. It's their flagship approach to this, and we're really proud to be part of that work. Next slide, please. To kick us off, we thought it would be useful to locate Making Manchester Fairer within that broader systems approach. And we can see there that we've got local knowledge and insights, what's happening on the ground, very much aligning with what our colleagues from Oxford have described about getting out and about in the community, burning through the shoe leather and knowing what matters to people. And that key experts by experience piece as well, those that live in a community, those that experience financial hardship, experience health inequalities, know and are best placed to know what they need. All of those things go into that Making Manchester Fairer approach, are integral to that approach. And running alongside that, we've got health and humanities research findings and, of course, huge quantities of very sophisticated data and analysis, which can also guide that approach, with the aim and the intention that that drives more effective policy, strategy and practice on the ground in communities, with that red arrow at the top looping us back round to how that approach can then feed into developments on the ground and further those local insights. Next slide, please. This slide is taken directly from Making Manchester Fairer. I can't take the credit for it. It does belong to the City Council. And this sets out the scope and the web and the network of Making Manchester Fairer. I'm just going to zoom in onto two parts which are most relevant to the community forum, the piece of work that we work on. On the orange left-hand side, we're looking there at that resident and community engagement and involvement, and also crucially the governance. The community forum, the beauty of it, the beauty of the forum is that it spans both engagement and governance. And then on the right-hand side, the grey themes. Today, with the forum, we've looked at preventing illness and early death, homes and housing, very, very topical in this housing crisis. And we've just started looking at a particular part of places, transport and climate change. Next slide, please. Gorgeous photo there of a couple of the members of the community forum. And this is where we can see that it co-produces that democratic involvement. Members of the forum there with Cordell, who's the Director of Public Health for Manchester City Council, very pleased as punch to be attending health scrutiny, not just attending and witnessing, but being invited to speak within that democratic process as well at Manchester Town Hall. Next slide, please. We're very proud to say that the Community Forum is an example of innovative social partnership. Now, all of us on this webinar, I'm sure, have burned through the shoe leather enough to know that community forums as a concept are not new. They've been knocking around for some time. So what makes this one special? I hear you ask. You may be asking in your mind. To us, it's that genuine partnership between residents, officers, and crucially elected members. It was a commission from MCC's Department of Public Health. They made an intentional decision to put that commission out into the community. What is it day to day? What is it on a Thursday afternoon? It's 16 Manchester residents from underserved communities, those most affected by health inequalities and least likely to take part, who come together, debate, discuss, determine, decide, challenge, consider MCC's plans for public health. One of the key success points for us was the recruitment campaign. We were really blessed that we worked hand in hand with MCC's Public Health Comms Department to produce a fantastic far-reaching recruitment campaign in a variety of languages, in BSL, and also placements in specific community publications. This generated 191 really high quality applications from residents, from ordinary people, and we had our work cut out to whittle those down. And we gave precedence to people having experience of homelessness, ex-military, local authority care, and those living in the cost of living priority wards. That sustainability and funding piece, I think that's the driver of why this is different to tokenistic forms of engagement. At the top of the tree, from the day dot, the commission from MCC was really, really clear. The commission amount for us as a facilitator was clear, was in black and white, as was the budget for member expenses, and that was already embedded into the commission. So all members who are part of the community forum are remunerated at real living wage for the following: the time spent at the forum meetings with us, their travel time to and from, their travel costs, a meal allowance because the meetings go over lunchtime or evening meal time, and crucially, they are remunerated for the time they spend reading resources and papers in advance. That was vital, being respectful of people's time, giving credence to the need to boost people's incomes during the cost of living crisis. And then to ensure that this was handled appropriately and didn't cause problems for people down the line, we signposted all our members to sources of information around benefits and how that may relate to benefits, and we also provided a letter to the DWP outlining that this is a form of community engagement, and we have flexibility of payments, whether backs or cash, depending on what members need. Next slide, please. The Making Manchester Community Forum is an example of co-producing that democratic involvement, and I really want to zone in here on why this feels quite different to what may have gone before and what some of those golden things have been that have meant it is proper, genuine democratic involvement. Number one, the Community Forum was embedded into Making Manchester Fairer governance structures at the start of the programme. Making Manchester Fairer is a huge, ambitious citywide piece of work, and the Community Forum as a concept was born within those governance structures straight away. We literally had a seat at the table from the get-go. Two, that right to request being established, and that came from the two executive members that co-chair the MMF programme board, so they have that overall governance and oversight. They've committed to this right to request. In other words, any city council officer who is asked to attend a community forum meeting is to attend that community forum meeting. That has worked beautifully in that everybody who's attended the forum meetings has been willing and able and up for conversation, lots of debate, lots of healthy discussion. Change to the programme board terms of reference. So we got there with a sign off that no item, no suggestion can be considered signed off by the programme board without consideration first by the community forum. So that picture before members being invited to attend and speak at health scrutiny and similar types of meetings. And we can see this, the evidence base that's now building as a result of all of those four things. It's created the thing at the bottom where the truth of members' lived experiences and their insights are being accounted for and are being reflected into policy objectives. Two big things generated lots of debate and discussion, as you might imagine. Number one, the importance of turning disused properties across the city back into affordable homes. And two, the impact of mental health conditions on people's ability to access cancer screening. It's not just as easy as when that bowel cancer stick comes through the letterbox. If you're a person with mental health conditions and other challenges in life, it's not that easy to do. It's not as straightforward as that. And those things coming from the community forum have been directly reflected into really high level policy objectives. Next slide, please. Little image there, simple image of the governance structure. That is going to the heart of what I've just been talking about, in that the forum, in that wiggly dotted box, feeds straight into the programme board, feeds straight into that executive level of thinking about making Manchester fairer. Next slide, please. And we'll finish off on this. A lovely case study by Amber. Amber's a fantastic valued member of the forum. She's been with us since the beginning. She attends every meeting. Very, very proudly a working class working mum from an area called Harper Hay, which is in the north of the city of Manchester. Lots of complexities and challenges within that area. And she's really proud to say that as a result of her engagement on the forum, she's got confidence she never thought she could have. And I can see for Amber, and we can see where engagement in something as high quality as a community forum not only brings positive outcomes for the individuals, for their community, but we have noticed that it is also beginning to shape and reshape that resident relationship. Oxford, our colleagues in Oxford talked about this before. People can sometimes see the council as just an authority, they take your council tax, etc. This piece of work is not only bringing about those improved outcomes for health and contributing to that piece, it's also shaping the democratic relationship and building trust between residents and the council. And I'm really chuffed and really pleased for Amber. She's been there at Health Scrutiny, speaking so fantastically about that piece of work. And she now feels that she could go back into education. She's feeling confident in the path that she's on. So we shall end that there. And myself and Rich, of course, welcome any questions. Thank you for listening.
Jana, is it? Yes.
First of all, a great presentation. It's really encouraging to see what you guys have been able to achieve. But I had a question around data, like what were your methods of reaching your community? Was it like mostly, I don't know, like flyers or online? Like how did you go about doing that?
Do you want me to take that a little bit, Holly?
Yeah, go for it.
Yeah. So as Holly said in the slides, that the City Council marketing publicity team were heavily involved. So we had that sort of very typical approach, so sort of blanket approach of digital. Some videos were made, those were shared. There was all the translation alongside that. But a real critical part was working with community anchors. So working with community hubs, who they would speaking to them first, telling them about what the recruitment's about, what the forum's about, and then they could go to speak to residents and explain that in a way which would make sense, but also to encourage, because as Holly said in one of the slides, one of the particular objectives of this was to get people who hadn't been involved in something like this before, and that can be quite difficult, because you can get a lot of people coming forward who've had lots of experience, but we really wanted to reach those who hadn't. And therefore, alongside that, like I say, alongside that very sort of typical comms approach, we did have this very much neighbourhood comms approach as well. And it's that when we looked at where the applications were coming from, you could pretty much track the highest neighbourhood applications were the ones which you could regard as having a strong community hub base there.
Thank you.
Thank you. I can't see the full screen, so is there another question? If there is, just
Yeah,
go
there's a
forward.
question from Marina.
Marina, thank you.
Thank you. Yeah, I'm Marina from Westminster and Kensington and Chelsea councils in London. Very interesting, the model that you shared. I'm curious, and sorry if you mentioned this, I was just curious about how you recruited the residents to be part of your Fair Communities Forum, and how did you manage to make the representation of residents reflected in that forum?
Do you want to take that one, Holly?
I'll take that one. Thank you. Thank you for the question, Marina. I could talk all day about this. You've set me off now. I'm on my soapbox. So as Rich has already alluded to and described, we work really, really closely with Manchester City Council's Public Health Communications team, who were brilliant. We could not have done it alone. And from the get-go, we had a really clear understanding of the groups of people that we were aiming to target, as Rich has described, those least likely to engage and those most affected by health inequalities. So it's safe to say we had to get creative with this one, because why should people engage? What's in it for them? So we had a whole plethora of digital, visual, printed materials, what you would expect to see. That was produced in 8 of the most prevalent community languages, a British Sign Language video, an easy read version for people with learning difficulties, and they were absolutely plastered everywhere. I think I might have wallpapered the walls with it at one point. They were sent out in every direction using all available means, and MCC tapped into their knowledge and understanding about reach. So particular formats were used more than others. Materials were made that could be sent out on WhatsApp, where people can share it really rapidly and where people can translate it for themselves on the phone if they needed to. As Rich has described, we had a hot list of really trusted community anchor organisations, local groups, established charities and organisations, where they were provided with information packs to have those one-to-one and small group conversations with people, help people fill out the application form. 191 applications, which we were thrilled about, and then began the difficult process of whittling them down to the final 16. It was all very X factor, and we went through a scheme, a really diligent scheme and framework of assigning points, for want of a better term, points and parts in a scheme for those people who had experience of some of those key factors that we know drive inequalities: homelessness, ex-military, experience of being in local authority care, and living in the cost of living priority wards. Those wards in Manchester that we know were disproportionately affected by cost of living and low incomes. So all that was done and whittled down again. It was actually quite a scientific method. It was the fairest way of doing it and the fairest way of giving credence to people's lived experience. Then from that point, we took a broader, more balanced view of looking at this group of people now on paper, because of course you're still working on paper, you've not met them yet. On paper, do we feel as though that their demographics and characteristics are representative of the diversity of the city, both in terms of personal characteristics, but also geographical spread as well? So we're pleased and proud to say that we had somebody from every part of the city, every patch was represented. And then from that, reached out to those final 16 and invited them to a really informal initial taster meeting, given the lowdown on what it's all about, get to know them, and let's see from there whether this is still the right fit for people and this is what they want. In total, my big long sprawling answer can be summed down to lots of communications in different methods, different formats, trying to reach absolutely everybody through digital and print, but also backed up by that community aspect to it, those community conversations, then quite a scientific methodology of whittling it down as to how are people representing those priority areas and those most underserved demographics.
Thank you. It's fascinating. Yeah, thank
It
you for
is,
sharing
I
that.
know.
Yeah. You got me right there. If we win the same time, we should go for a coffee.
Please do. I could talk
Yeah.
all day. You've got me on my soapbox now.
Thank you.
You're welcome. Is that another hand somewhere? I'm also can't
Yeah,
really
we've got
see
a
the
question
full
from
thing.
Catherine.
Hi, so I've just noticed my dog is impeding on my
Oh yay, dog.
Sorry about that.
Oh, yes,
Oh.
come and say hello.
I don't get
Please do.
mid question. Yeah, just it was really interesting, which I think we've met before, haven't we? On CCIN. I remember now the project. Really fascinating. So so helpful. I think I was just sort of I'm really interested in governance, and I know Westminster has had discussions before with Manchester around their governance, and particularly around sort of poverty board, that sort of higher level stuff. But I guess I was interested in, because you said at the beginning you're in a specific area of Manchester, so is that Girton and Denton, Girton, and is that so? Do you replicate what you do? You're a CIC for one particular area. How does the sort of the board, the overall Manchester City Council Poverty Board sort of take all the work from your different areas into what it does? I mean, do you have the board that you just described? Is that replicated all over? Is there different groups? So I hope that question's a bit wandering, but hopefully you see what I'm getting at.
Yeah, so first of all, from a Health Inequality communities point of view, that's separate to what the community forum is. We are commissioned to facilitate that.
Right.
What we do is bring our expertise. So although we are our hub, our community centre is based in Gorton, which is the famous by-election today.
Yeah, all eyes on you.
All eyes are on us. We've been keeping a head down for a month. Yeah, so we have a hub base there, but we also deliver citywide work as well. And our sort of our power in practice work is citywide as well, and GM at times as well. So, but they are separate. So we bring our that enables our expertise. That enables us to not only talk the talk, but we walk the walk as well. We have a community centre within one of the most deprived wards, which we see those challenges, those experiences, but motivations and all the positives which come from those wards as well. So the community forum itself and the governance of making Manchester fairer is drawn from all across the city wards and all across the demographics, some of those which Ollie has mentioned. So Manchester has both the equality strands, which we'd recognise, but also recognises 4 more, which is the military, leaving care, homelessness and the cost of living wards. They are enshrined within their work as well. Yeah, so in a sort of, it's a citywide approach, and the governance. So the programme board has also got both council officers, elected members, and VCSE representation from across the city.
Okay, great. Thank you. Thanks very much. Thanks, Lucy.
Thanks, Rich and Holly, for that really great presentation. I feel like I'd gotten to learn quite a bit about your work and the community forum through conversations with Rich, but yeah, that was even more in depth than those conversations, and I was just like, wow, incredible, amazing work. So thank you for speaking to us about that. And so we're now on to our final speakers for today. We've got Kate joining us from Liverpool City Council and Rebecca joining us from Liverpool Lighthouse.
Oh, thank you. I don't know how we're going to follow those 2 good presentations, but we will do our best. So yes, my name's Kate Steen. I'm a senior public health practitioner in Liverpool City Council, and I'm joined by Rebecca, who's one of our community champions from Liverpool Lighthouse. So thank you. Next slide. So our initiative of community champions is aimed at addressing health inequalities with that particular focus on the city's most deprived communities and underserved groups. The programme comes out of a response from a landmark document that was produced called the State of Health 2040 report, which highlighted that the future burden of ill health in our city, if we didn't do any major interventions and then they weren't implemented, and without any action, that we potentially could see 1/4 of our residents living with ill health. The number of our adults could experience depression could double. Those in the most deprived communities were likely to spend more years in ill health than in good physical well-being. And over 4,000 more minority ethnic adults could be living with major illnesses. So back in 2021, the first lot of community champions were developed. And they were there to help us to increase that compliance of COVID, looking at the guidance, looking at vaccination uptake, some of the evidence that was being presented to us. We were seeing that some of our communities weren't coming forward for vaccinations because they couldn't read the leaflet because it wasn't in their native language. By working with our community champions during this time, it did give us that insight into the barriers as to what were preventing people coming forward. It gave us that good engagement across the city to help us to have those conversations with our underserved communities and support that increase in health and well-being uptake as well. And most importantly, dismiss them COVID myths that sometimes that were circulating around communities. Thank you. Next slide. So our primary goal I'll call them COVID-19 champions for now, because we'll move on to that, was to offer that community leadership, give them that influence, increase that engagement and that uptake of health and wellbeing services, but also looking at how we empower our communities to magnify their voices and giving them that platform to have those conversations around some of our health inequalities, things that we were seeing. Thank you. Next slide. So working closely with the public health team, the champions were there to deliver that outreach, collect that feedback from our communities. We worked with them to co-design the solutions and identify those barriers. They delivered many health campaigns for us, but we're also that catalyst in being able to cascade that information to those communities in an accessible form and making sure that it was delivered in that appropriate cultural manner as well. With that, next slide, please. And delivering through that, there's just a couple of things that I'll allude to on here, but it's around that trusted voices, which I think the two speakers that have spoke previously today have mentioned that. It's about building that relationship with the communities, those that are trusted voice in that area. And again, the key thing for me is around that continuous feedback and that anticipation and that adaptation of leaflets, maybe that, to make sure that we're getting it right and it's sort of continually learning and as we go. Funding was also attached to these community champions. It's okay, Michael. Funding was also attached to these community champions. But then in 2014, building on the success of the COVID-19 champions model, the new model was then implemented, which saw a refresh, and the 10 champions that you can see there on the screen were funded for 3 years. So that allowed that bit of sustainability, a bit of security for 3 years, knowing that they had that investment to be able to support us in developing and addressing our health inequalities and giving us more of that targeted focus. Not all the champions that you see on the screen were in that first cohort of COVID-19. So through a process of grant funding, applications were submitted, and again, through a vigorous process, the best were selected. Again, it was working closely with public health so we could offer that leadership and influence, but then develop that capacity. And as part of our programme of community champions, each organisation, we have a development day once a month where we come together, we build that relationship, not just between public health and the champions directly, but it's about fostering those relationships between the 10 of them. So some of them have gone off and done, so for example, Irish Community Care had a lady that came that spoke Arabic. Our community champion in Irish Community Care didn't speak Arabic, so she linked in with the Arabic Centre. So it was about building that resource internally as well, so that we can support one another. With that, next slide, please. Our priorities for year one were increasing vaccination uptake, so it was building on from the COVID-19 champions, that mental health and well-being, cancer awareness and screening, and cardiovascular disease, where all our champions are trained to do blood pressure checks. So when they do outreach sessions, they can offer that, and then if there is an issue, refer them on to their GP for additional support. Some of the examples of what our champions have done. So over 3,000 community-based activities have been delivered, and they've been recorded and disseminated multilingual content to be able to support residents accessing the services that they need. We've done pop-up vaccination centre activities, and then 280 health checks have been performed identifying some of the main causes there, which has been really positive as well. Thank you. Other examples that they've done is they've supported us in translating documentation. So whether that's to be on Facebook posts or physical leaflets, and they also support us with the Live Well bus. So we have a Live Well bus across Cheshire and Merseyside, which the champions can book, and that will come to their locality. Maybe that's where the community centre is, and then they will support in promoting that. But then also when residents and volunteers turn up, having those conversations to let them know that cervical screening is taking place today, and that they can pop on the bus. So it's really trying to build that relationship in the community firsthand, so people can see what's happening and access those services when they need them. Examples of where that champions have shared with us around like the challenges of mental health. So these are just a few examples. So the stigma holds many people back from discussing the mental health, but then the champions are really good at overcoming those barriers. So for example, it's about building that trust. They recognise the faces that are coming through the door, so that they build that rapport, so they're able to have those conversations and signpost appropriately on there as well. Community members, again, at Christmas events, is just another example where they've provided that information and signposted. It's been culturally specific, so their examples are appropriate and people can relate to them. And again, the big outcome is that the information is welcomed, and even though the uptake of maybe cervical screening might not take place on that day when that conversation's had, but it's an opportunity that they can go back to later, a later time, to have those additional conversations and encourage community members to take up that opportunity. Another example was around cancer. Next slide, please. And again, leaning onto that cultural appropriateness as well. A lot of the information that champions were sharing was that if we talk about cancer, that you will get it. So it's how do we sort of give them the evidence and the information to allow them to make that informed choice. But again, holding the awareness events were really important. It would allow them to talk through the screening process. Health professionals were invited as well to be able to have those conversations. So it's a sort of around that network and bringing everyone who has a vested interest to be able to have that conversation. Thank you. And again, that's just another opportunity around the screening bus, which was situated at the Women's Hospital, because it was there in situ for quite a long time. People were able to see it, and it sort of planted that seed that this bus was available. They could have conversations, and it may have taken 8 conversations over 8 weeks, but people were then gaining the confidence to go and access the breast screening bus, which is brilliant as well. I'm now going to hand you over to Rebecca, which is probably the best bit of my job of working with all these 10 champions. I invited Rebecca today because I felt I possibly couldn't do it justice as much as what Rebecca will do. So yeah, I'll hand you over to Rebecca now for her bit, and then I'll come back to just share with a little project about what we're working on at the moment with the champions. Thank you, Rebecca.
Liverpool Lighthouse is a national portfolio organisations. We're funded by arts councils. We're an arts organisation as well as a community organisation. And that's gorgeous because it means that as well as having spaces where we engage with the community, we also have a 400-seat theatre, recording studios and a dance studio. We are on the boundary of Anfield and Everton. So we are in neighbourhoods that suffer some of the worst deprivation nationally, within the worst 1%. And if you look at who is engaging with us at Liverpool Lighthouse, 79% of our community participants are asylum seekers, refugees and migrants, and 86% live in the most high deprivation postcodes in the UK. As an arts organisation, we feel with the poverty within our neighbourhoods, the area that we could have the most impact is on mental health and well-being and health. And of course, we're biased, but creativity is an amazing tool to be able to achieve that. We work with the other community champions, which is amazing because they work with similarly diverse communities. We also partner with our local primary care network, Anfield and Everton, and also with Brownlow Health, which are a series of surgeries in Liverpool, but they have expertise in complex lives, in homelessness, and refugees and asylum seekers, and also with our community manager.
So our next, every photo tells a story is a project that we're working on at the moment, which is around the capturing of photographs and imagery. So what we've done is we have worked with the 10 champions. Next slide, please, Michael. We've worked with the 10 champions and we provided them all with disposable cameras. So they all got 5 disposable cameras, and the caveat was, what does health mean to you? And we sent our champions out with the cameras to take photos of things that made you feel good mentally, physically, socially, or spiritually. Who and what supports you to be healthy in your community, your social network spaces, and changes that could improve health and well-being. It was brilliant. It got rid of the instant filter, using of your photo, taking the best picture. It took me back personally to being a child, which I don't know if you remember, you had your camera, you'd roll it on, you'd take your picture, you'd forgot to put your flash on. It was wonderful. It sort of allowed us all to regress back to being useful maybe in the 80s and 90s. But what we champions did with the 5 cameras is they then cascaded them out to community members to sort of get a different perspective from people within their community to see how they understood and what they felt health meant to them as well. So next slide, please. To support them in doing this, we ran a photography workshop. So we worked with a local photographer, Emma Case, and she was really, really good. She brought her skills as a professional, as a creative, to allow our champions to explore what made a good photo. Was it the framing, the symmetry, the perspective that you were taking it from, lighting? So they all got trained in a little bit of how to be a photographer, which was really lovely as well. And again, I think using the disposable cameras, there was a little bit of uncertainty there because we didn't know what the photos would turn out to be like. We didn't know if we were capturing the best picture. And part of it, some residents did say they felt a bit vulnerable because it was sort of that unknown. But the work that was produced has been phenomenal. Next slide, please. So on the back of that, we ended up with about 600 photos. This is just a little snapshot. And what we've asked the champions to do, working with Emma, is to create a caption. So the example of the fruit bowl, that was the lady described that as good food, good mood. We did think when we said food, we might get a lot of pictures of healthy eating and things, but when we started to delve into what the photos were and what they meant, the photo which shows the plates of food was around connecting and eating with family, and that was taken from a member of the Chinese wellbeing community. So what we've asked them to do is to write a caption and write the caption in their native language, because what we have found is some of the words that they may use in Cantonese don't translate into English, so we weren't getting a true perspective as to what this photo meant. So they've captured the photos, they're all going to produce a caption that will sit underneath, and then that will be produced into our exhibition. So next photo, please. And around allowing us to do that photo project has really allowed us to involve communities, and that has been invaluable. It's given us some really good insight into how communities are working. It's providing us with that lived voice and that lived experience, which is so, it's amazing when you start listening and you start talking to people. It gives us that cultural fluency, so we've been allowed to understand how things may be different. Some people that we've been working with, so communities, children haven't been able to access schools, so we've been able to support them and to do this. So it's really enabled us to unfold and have that in-depth, more conversation as well. Thank you. It supported us with that meaningful co-production, and I think someone mentioned it before. What we're trying to get here is not being tokenistic, and I think because the programme is funded for 3 years, it's allowing us to really build them good foundations. The priorities that I introduced before at the start of the presentation, we're now going to take what the learning from the photography project to see if there's anything else that's emerging that potentially could be our next focus for the year ahead. Really keen about that decision making, and we're working with each other. It's about that sharing decisions, sharing that responsibility, but also that learning as well. Where can we learn from one another, and how do we flex and adapt to enable our communities to understand and receive the information that is important to them? Thank you. The insight has been brilliant. The COVID-19 champions, there was an evaluation produced by Liverpool, John Moores University, which I can share after this. So that again gave us the insight, and it showed us how practically applying some of these skills to that wider council offer can be really informative. Looking at how we work locally with the networks, how do we increase our scope? Liverpool is a marmot city, so this is something that can be embedded within that. So looking at reducing those health inequalities and acting across those marmot 8 principles that we're looking at, creating those healthy communities, strengthening that prevention, involving communities, and embedding within all health within all policy as well. The investment for us is really important. So as people may be aware, the public health grants are being allocated from April, and we're giving us that three-year funding. So again, when this current programme comes to an end in 2027, we will be looking at how do we enable and utilise the future funding to be able to grow this project. The champions are brilliant at collecting case studies and reporting the data quarterly, because again, that gives us that foundation and that evidence to suggest why this programme is valuable and why we should continue to invest in it. Thank you, Michael. Next slide. I think the golden thread throughout of this is about trusting those relationships, and I think it was mentioned before that sometimes councils aren't seen in the best light, but we are there for residents. We are public servants, and we are there to make our residents and neighbourhoods healthy, for where people can thrive and grow. It's really about sharing that best practice and sharing and understanding some things that may not work. That's all right, and that's part of that learning, and how do we make it better and improve it. Really listening to our communities and allowing those to help and shape that best practice, and make communities understand that we are listening, and going back and again sharing and supporting the resources. A development of this as well is we've been fortunate regarding the youth work. So we're looking, and we've just successfully funded 6 youth organisations. So we're going to try and develop our youth champion programme. It's very much that test and learn. I feel it will be very different to the community champion model that we've got at the moment. But it's how do we support those youth organisations to give that investment into our younger people, to allow them to grow, to be our public health voices when they're out there speaking to their peers. So that's something that's developmental, but again brings a lot of excitement, and there's a lot of learning from our community champion programme that we can feed into this as well.
So as a community champion, like, what is it that we do? Well, we are able to share information and communication directly from public health, which is amazing. And that might be health campaigns, special health days in the calendar. Our communities are people with lived experience of some of the worst health inequalities, and they are able to contribute to inform publications, films, and so forth. But I think what's really impactful is in our organisation, we initially really focused on mental health and wellbeing. And so, for example, we have a migrant mums group with over 50 women that are registered. A lot of them are in the asylum system, and they really benefit from coming to Lighthouse in terms of having, sometimes it's the only time that can be just about them in the week. We provide a creche, food, a hot meal, and really work to build the women's self-esteem and confidence, and improve their mental health and well-being. And that's a space where the women laugh. It's very comfortable, cozy. They breastfeed in front of each other, and it's there's a lot of trust there. And so we started introducing a layer of health to this group. And the initial session was a breast checking session. A member of staff from the Women's Hospital came to provide that, and it was just so impactful. I think because of the trust and the relaxation of the women, looking around the group, they really engaged. You could see that this was new to quite a few of the women. But I left thinking, I actually believe that the women will check their breasts, but not only that, they'll talk to their friends and families. And so that's a really fertile, brilliant environment for that sort of activity to happen. So we pushed the boat out yesterday and did something similar on cervical screening, and had a model vagina. And that created a lot of hilarity in the group. But again, the women really engaged and talked and shared their experiences and asked questions and so forth. So it really is impactful. As Kate has mentioned, we have access to the Live Well bus and events. And actually what we're starting to do is taking Lighthouse to our doctor's surgery. So we're just planning the second one at the moment, where we provide creative activities for adults, but also a lot of fun activities for children, food, and we've got our staff and health professionals there. And it means that families can come, they're relaxed, the children are having fun, mum can have a conversation while her child is getting her face painted and so forth. And we think that this is something that might really work over time. It's incredibly useful having health professionals from the Women's Hospital, from our PCN, coming and working with us. And then we work together on specific health improvement collaboratives. What I was going to show you was a clip from a film that was made by a group of women with lived experience of the asylum system. And our local PCN asked us if we would make, on a shoestring budget, but a film by women with lived experience of the asylum system for other people that are new to the UK about immunisation. That's on our website. I think something that's really useful in it is that we know there's a lot of barriers for people within the asylum system where GP surgery staff don't know that you don't have to have proof of your where you live or status. Women with lived experience of childbirth in the asylum system who are called creative influencers. And I just want to talk about the impact of collaboration where lived experience is really at the start and helping to drive the work. The collaborative models that we work with has people with lived experience, it has a creative artist, it has health, and that includes our local primary care trusts and their networks, specialist health organisations. So if it's on childbirth, it would be the Women's Hospital. If it's on cancer, it might be Cancer Alliance. And wherever possible, researchers. And we were really fortunate with the example I'm going to give that we had researchers from Liverpool University and School of Tropical Medicine. We were asked to do some work on the low uptake of whooping cough pertussis immunisation for ethnically diverse women and women in the asylum system. And if we had started with national research, then it consistently says that the reason why there's a lack of uptake is that the women don't trust the vaccine and for cultural reasons. And actually, we did over 100 surveys with women with lived experience at the Women's Hospital, and it was led by women with lived experience. Actually, in the process of doing the surveys, the hospital said, we would like you to be doing more of this because we're getting more people coming through for immunisation, just because of the conversations that happened in doing that. But what was really interesting is that the data very clearly pointed to the actual reason why there was low uptake. In fact, most women were familiar with whooping cough from the countries that they had come from, but they said that they were told about several vaccines together, COVID, flu, RSV and pertussis, and there's an issue with that because there's more vaccine hesitancy over other immunisations rather than the whooping cough one. They also said they didn't know how to get it. And I suppose in your maternity journey, normally appointments are made for you. But if you are struggling to access healthcare in the first instance, or there are barriers like the finance of getting to appointments, then that is an issue. They also said that they really did trust doctors and health professionals in that information. So as a result of that, working with the Women's Hospital, we created a 1-minute film. I urge you to watch it because it's not like your normal vaccination films. It's an AI film where we created a baby that we wanted to look real but be far too cute to be real and to engage with your audience. And that film is a tool for midwives to introduce whooping cough. And we did that because we wanted to make sure that it was being talked about in its own right. But the Women's Hospital then agreed that they would introduce, or mandate midwives to introduce the conversation about pertussis at the week 16 appointment, and then to encourage women while they come for their scan at week 20 to have it on site at the same time. The film is currently on the screens in the Women's Hospital on 2-hour loops. It doesn't really require language, but it's got a little bit of text in it, which is on one version in English and another version in Arabic, because that's the most common language spoken. What's interesting about this is that the Women's Hospital about a week ago got a letter from NHS England basically saying what is going on in your hospital, because I don't know the period of time, but they've gone from 100 immunisations to 600 immunisations. So we know it's really working, and we've had an email from Public Health indicating that as well. We won't have the actual data until July, but it's really encouraging to that's working. Also, alongside that, we created a pregnancy journey poster, and that is in the presentation, but it's also on the Cooperative Health page on our website. And that was designed to enable, really, for women in the asylum system to be able to see their maternity journey and what the health focus is for each appointment, but also with advice and guidance from women with lived experience and from health professionals. And on the back, it's purely QR codes, really, with links to support for them. And that's been translated into 5 languages, with enough, is routinely now given at the booking appointments at the Women's Hospital, with enough for the next 4 years. And just wanted to finish by saying that this is one particular project. There's another project that we did using this model, which was about childbirth in the asylum system. And I think the model where lived experience is really at the start of it. For the project around childbirth in the asylum system, we did this when the statistic for Black women living in poverty was that they were almost 5 times more likely to die as their baby from when they were the woman was first pregnant until the baby was 12 months old. And there was no data on the Embrace report or being shared or taken about the deaths of women and babies within the asylum system, even though historically evidence has shown it's much higher. So there hadn't been any data since 2011. And so the women on the first day of us working together, when they were asked, if we're really going to focus on an outcome for this, where are we going to put our money? They said training, because the Home Office isn't going to change, the asylum experience isn't going to change in the short term, but if health professionals understood the experience, there's things that they could do that would really help and would actually save mum and babies' lives. And so that was a focus with the project. In order to ensure that lived experience really does drive it, then we have to have a separate project running alongside the main one, which is purely for those women together to creatively explore, to discuss, to prepare, and opportunities for them to lead within the main project. And sometimes it's completely collaborative. And sometimes the health professionals and the women are working absolutely together, but sometimes they're working separately, so we still have that very pure, clear voice of lived experience. And actually, for the Whooping Cough film, the film was storyboarded by health professionals and by the women separately, and the final film is very close to what the women said. And basically they were saying, you know, in England, sometimes we find it frustrating that you are too frightened to be direct, and we need to know the risk for babies and how devastating this is if a baby was to catch whooping cough. But we just want it to be so simple, and that's actually, I think, what the film does. But we've run out of time now, so I think you'll get the presentation, which will be shared, and there's a link in that to the Cooperative Health page on our website, which has the films.
I've put everything in the chat, Rebecca, for you from the website. So yeah, thank you very much for that. I think Rebecca alluded to that, again, limited budgets, even though you may have that, can still result in like good co-production, and yeah, around that innovation, partnership working and creativity is quite fundamental to how we deliver our Champions project.
Thanks both.
Can I just finish? I forgot to say, so sorry,
Yeah.
I forgot to say at the end that the impact of that lived experience collaboration with health, if you look at the childbirth in the asylum system, that film and training resources is now endorsed by the Royal College of GPs and the Royal College of Midwives. And if you're an undergraduate midwife training in and around Liverpool, which would be at Ormskirk, Edge Hill University or John Moores University, that is part of your training now. There's a specific part of a module which is about the experience of the asylum system, which is so impactful because a lot of health professionals train without that whatsoever, even though some of the worst health inequalities are for that experience.
Yeah. Yeah, thank you. Thanks both. Yeah, amazing and interesting presentation. And yeah, we'll share those links and the slides as well when we share sort of all the materials from the webinar. So thank you very much. I guess, yeah, we've gone over time, but does anyone sort of have a burning question for either Kate or Rebecca before we wrap up?
No questions, but just to say thank you, and I'm itching to get off the call, not because I want it to end, but because I want to watch the video. So I'll watch it straight away. So thank you.
Thanks, Catherine. Yeah, thanks everyone for making the time to come to this webinar. I appreciate, you know, a lot of these things can be hard to commit to because they happen in the middle of a working day and all of that. So yeah, really, really grateful that you know, you all could attend and be here. Unfortunately, some people did have to drop off towards the end just due to timing. But yeah, thank you all, and I hope you found it useful. I mean, I myself found it very interesting and insightful. So yeah, thank you, and materials to follow.